Hi, I'm Dr. Nicole Vane of Moonlight Beach Dental. We're a general and holistic dental practice here in Encinitas. And one of my new products, well, it's not even my new product, but one of the products we supply here that I'm so excited about is to assist with our mercury removal. One of the things that really excites me about it is I've had great results myself with mercury detoxing with the Quicksilver products, but a lot of patients either found them cost prohibitive or they found them a little too complex, because it'd be like a 1-month supply, or in my case, when I had to do it for multiple months to detox from the mercury levels. So in our other video, we talked about the mercury tri-test, where you would have your blood tested for your baseline mercury levels to see if you are in fact mercury toxic. Some patients choose to forego that. It's a $300 test. That's not to us, but it's to the Quicksilver company. But they choose to forego it because they're not really worried about being mercury toxic. They just want their mercury fillings out and removed safely, and they want to have additional coverage for it to know that they're able to detox their body from the mercury once it's been removed. So an important component of that first is that you have a doctor who is SMART Amalgam Removal Certified, which stands for Safe Mercury Amalgam Removal Technique through the IAOMT. So I'm certified in that, and also someone who has gone through the Huggins protocol. They're really very similar. I'm certified in both, but we're educated on how to use the supplements to help people detox. I personally cannot methylate well or remove mercury from my system. So while I was very lucky that I never had a mercury filling growing up, I became mercury toxic just from being around it in my dental environment. So we used to have to take a series of level of supplements. Now, for a simple $100 charge, you're given a level of supplements that'll cover you for 1 week of mercury removal with a simple protocol. So you're going to take it a couple days before, and then you're going to dose specifically for the day of, and then you're going to take it a couple days after. So the Protect is what it's called, and it's a liposomal glutathione, which is one of our body's most powerful detoxifiers. That's also something I genetically don't make a lot of, nor do a lot of other people. So the liposomal glutathione is going to help grab and take out a lot of those mercury that might be floating around in your system. The other thing is called the Amalga Clear, which is a paste-ish form that you're going to take. And what that's going to do is it has a lot of things in it to draw the mercury out of your intestine, because it's typically excreted through the stool and the urine. So it's going to help grab a lot of the excess mercury that might be residing there, even old mercury that could be in your system. So Chris Shade of Quicksilver, who's the developer of the company, came out with what he calls a push-catch system, which is that they're pushing the mercury out of the cells and the cell membranes, and then we're catching it with some of these other products and supplements and antioxidants to help properly excrete it before it becomes harmful to you. So the new Protect protocol is very simple, very easy. We have it here in the office. You can easily take it within a day before your mercury removal. And I really hope that if you're ever here and you have questions about it, that you feel free to ask me, as I'm here to support you on your wellness journey. And feel free to come talk to me anytime here at the office at Moonlight Beach Dental.